Hello, and welcome to the video I've created for informal assessment for pre-hospital care providers, which involves the use of summary cards at the end of the day. Let's begin with the agenda. The first part of this video will look at the strategy. We'll then look at the best fit, disadvantages and advantages, best practice, feedback, ethics, and finally, validity and reliability. The strategy will begin with an introduction by the instructor, introducing the strategy to the participants, describing how the cards will actually be used. The cards themselves will actually be stored inside envelopes. Groups. Each participant will be randomly assigned to a group using the 1, 2, 3, 4 method of division for groups, as an example. There will be a time frame for this activity of approximately 30 minutes. Envelopes will be given to each group, not to open until everyone is ready. Each scenario in the envelope is the same, however the stages are different according to the scenario. Each group will be organized into a time frame where they will take 5 to 10 minutes to decide which 5 steps they would take relating to the stage of their scenario. This will be done by sorting through 10 pre-made magnetic cards to pick the first 5 steps. Reference. Each group is permitted to use their standard grading sheet, rubric, otherwise known as a skill sheet, for reference. This will encourage participants to work within the protocols and the material taught. Placement. Each group will be asked to place their decisions on the board for the entire group of participants to view the complete stages for the scenario. An example of a scene arrival card might look something like this. An engine company and aid unit have been dispatched to the intersection of Lakewood and Hale for a truck versus pedestrian accident. You arrive to find bystanders cradling the head of a cyclist. The driver of the truck is walking around the road confused. Based on the history, what 5 steps will need to take place according to the scene arrival guidelines based on the marking rubric? A copy of the marking rubric or student skill sheet is actually placed on the PowerPoint. So for example, some of the common steps would be staging the ambulance in a safe area. This would create 1 point for the group. Details on scene. In other words, letting dispatch know that the unit is on scene. Takes or verbalizes BSI precautions. Scene size up. Determines the scene is safe. Determines the mechanism of injury. Determines the number of patients. Requests additional help and resources if necessary. Considers stabilization of C-spine control. Once each group has had a chance to actually go through their card, read the description, and sort through the information contained in their envelope, they will be able to go up to the board, and on the board there will be 4 headings. One will be for scene arrival, one will be for initial assessment and triage, then we'll have rapid intervention, and then transport, sick or not sick. So for each group, upon approach, what 5 steps should be taken first for each 4 category? On the board, each group will list their steps based on their protocols aligned with the grading rubric criteria, which is otherwise known as their skill sheet. The best fit for this strategy would be at the end of each day. There would be typically 2 modules taught per day. I prefer to use a summary assessment to ensure participants have acquired their learning outcomes for the day. And ideally, where there are larger courses where there are at least 12 participants or more for diverse input. What are the disadvantages? This strategy has narrow focus and will apply to specific areas of pre-hospital care only, so it may not apply to pediatrics or geriatric care. However, it will only apply to, for example, cardiovascular emergencies. Some participants may have less field experience than others and may not be able to be guided by real scenarios. Time. If not managed, it's possible for this strategy to take longer than needed. And then there's issues of patient privacy issues could be compromised if real-life situations are discussed amongst participants. Advantages. The instructor is able to walk around the groups and listen to discussions and rationales. The instructor or core instructors is able to coach groups that may be having difficulty with their decisions. Participants can be monitored for their input, and instructor or instructors can prompt those quieter participants for their thoughts and have them become more motivated to be a part of the group. The instructor is able to determine which students have a strong understanding for future pairing with others as mentors. Lowering of anxiety of participants by working in groups and forming relationships with coworkers. There's a diverse range of input into the decisions and rationales, which creates very comprehensive teamwork. Time for the instructor to alter the lesson plan based on participants' needs from the assessment. Adds variety to the typical style of learning and assessment to stimulate interest in participants. Best practice. This strategy must be thoroughly explained to the participants prior to commencement, providing clear and concise instructions to the participants and possibly listing on the board. Give positive feedback to stimulate thought in all participants, and engage quieter participants into the conversation by asking for their thoughts by the instructor circulating through the groups. Delivery of positive feedback. There's 4 different ways this can be done. There's ongoing, positive, clarification, and linking. For ongoing, the instructor will provide feedback on each group's rationales why they circulate throughout the class. Positive. At all times, the instructor will be encouraging to keep their participants focused on the learning outcomes for the day as it relates to the strategy. Clarification. As information is posted on the board or flip chart, the instructor will be able to provide coaching and emphasize correct answers. Linking. Incorporate feedback into the instructor summary for the day, linking to the previous lessons and the marking rubric. Ethical considerations. When using examples, some participants may have previous knowledge and experience where real-life scenarios are being discussed. This can lead to patient privacy issues being compromised accidentally. Let's now look at validity and reliability. So for content validity, the student skill sheets, their rubric, are directly linked to the theoretical and practical skills demonstrated by the instructor and practiced by the participants in class, which describes the protocols in relation to this assessment. Consequence validity. Less stress on the participants and lower anxiety on the performance. Construct validity. The assessment is measuring knowledge based on learning objectives. Predictive validity. The participants are guided by the skill sheets and have experience with the protocols on the sheets and therefore will continue to be guided in this assessment. Finally, process validity. Directly impacts the reliability will be maintained by the use of the skill sheets, which are the same skill sheets used during the practical skills assessment and the final practical. The skill sheets list all protocols in a logical, descriptive way to prevent confusion and direct the participant to the correct actions consistently. In summary, the objective of this informal assessment has been to provide the instructor and the participants opportunities for growth and learning aligned with the course outcomes.